Hey guys, Devin and Tim Smith back again with D R Burton Healthcare. Thanks to all of y'all that watched our videos and provided feedback for us. I hope that was helpful for you. We're coming to you with some more ideas today. We're a couple weeks into this COVID-19 crisis now, and we've been learning a lot, hearing a lot. Thanks to all of you that are on the front lines, especially our friends in the Northeast, New York, New Jersey, that are especially hard hit. We're still hearing a lot of the same story about vents, PPE. Something that the news neglects to mention on the other side of those ventilators is a respiratory therapist, is a provider that's managing an airway. That is by far what we're getting the most interest in from our customers. They're reaching out about help with intubation with airway. So I've got the expert here again, Tim Smith, a lot of years in critical care, paramedic, intubated a lot of people. I've heard crazy stories. And so he's going to talk to you about some tools that can be helpful for you today.
Yeah. Thanks, Devin. And once again, thanks. Can't say it enough. We do have a unique tool here today that's going to make a difference. And one of the things we did here, we had the good fortune to listen to a case study out in Washington. And he said, patient ground zero.
Yeah,
that's what
absolutely.
they say. And with that patient, what I took away right away was that when they went to intubate this patient, removing him from his non-rebreather, that patient desatted very, very quickly. They crash and burn very, very fast. So what do? We got to be prepared, and somehow we need to have the best tools available. You know, the old school intubation, we all did it with the old standard laryngoscope blade and handle. But one of the bad things about this, you're right down there close and safe, and that patient, you can trigger that gag reflex, they cough in your face, it's nasty. So these are all difficult, and one of the things a lot of people are going with video laryngoscopes. And that is the best practice in this situation. It gives you a much better view to see the cords and do the procedure. When doing that procedure, a lot of times people like a nice rigid stylet, semi-rigid, to put in the right position. This is the one that's been out on the market for a little while. This device here, it worked well, but there's some things that we've improved on. One is this is a wedge design. It sticks into the tube, sometimes very hard to get out. And one of the things too, it has to be processed. This is a reusable, so you know, a lot of times you just want to throw away and go to the next. Let me introduce you to ours. Ours is called the J1, the J1 Advantage. Here's what it looks like. Right away, pretty similar, but you look at the main part right here. It's got an ergonomic design. A couple things you'll notice real quick. We have a quick release, pops right out. It also fits over the ET tube, kind of like your resuscitation bag. And the O-ring here allows you to pull it out real easy. It's a one-man show, very easy to manage. But you'll see one other thing that's different. This little port here, this is the key, especially for our COVID-19. Again, what we keep hearing, they crash and they do it fast. Get some oxygen tubing. This is an oxygen port. We also call it the Apneic port. 5 liters of oxygen from your flow meter. Guess what? We're delivering oxygen right down at the proximal area, right down at the carina area, enriching the lungs with oxygen at 100%. This is going to buy you valuable time. Very, very important for these patients that are crashing very quick. Also, when you're done, remove, discard, ready for your next one. So it's complete disposable.
Yeah. And so, you know, Apneic Oxygenation is not that new. This is just a great new and easy way to do it. It's going to be very, very effective. Big study out of the Mayo Clinic, 1,800 patients in the ED in an ICU, and that's where a lot of these COVID intubations are happening. 159% increase in first pass success rate and a 66% reduction in hypoxemia. So that is a huge, huge issue with a lot of these COVID patients. And don't discount the first pass success rate. So in a lot of these heavier hit areas, providers are, you know, a hot commodity. And so you might have people that are inexperienced. This is a very heightened, scary situation. And so the oxygenation really helps diffuse the situation, increase first pass success. And again, those patients are desetting quickly. So that's a huge, huge help. So he spoiled the best part that these are disposable.
Yes.
So,
yes.
Which is absolutely huge. And something that we're hearing, a lot of these customers are reaching out and saying, hey, we've been using these reusables and they're working fine, but they're going to CS now, and CS is totally backlogged with everything that's going on. You know, everybody knows that cross-contamination is a huge issue, but, you know, you might not be getting them back as quickly as you want, so this is just going to help you have them available when needed, which is huge.
One last thing, too, just so we have a secondary design. If you had that ability to do a pre-assessment and you have a real anterior, you know it's going to be difficult, we have one with a bougie on the tip. You can see, just to give you an idea, it's nice and flexible, nice, put you right in position to get that tube in first pass, like he said.
Absolutely. Well, we hope that's helpful to you guys. Please reach out to your D R Burton rep if you have any questions. Also, the website has a ton of resources, drburtonhpi.com. And stay tuned for more to come. Thanks for all you guys are doing.